Well, many times you just don't know because many times the patients present with early disease or mild disease that could be observed without any symptoms. Many times the diagnosis is made by the clinician that sees the patient for a regular physical exam, or a primary care doctor that finds that his patient has a large or increased number of lymphocytes in the blood. In the case of chronic lymphocytic leukemia, for example, most of the referrals to me are from primary care doctors that saw a patient for a routine annual physical exam who found that the patient had an increased number of lymphocytes. Let's say that they did a blood count and the patient has 20,000 white blood cells with about 80% lymphocytes. So that is suspicious. And that is usually the way we diagnose most cases with chronic lymphocytic leukemia. Other lymphomas, patient may present with fever, night sweats, weight loss, or patients may go see a doctor because they have a lump in the neck, for example. So basically, in most cases, fortunately, in the new millennium, we diagnose the cases early. But sometimes patients present with a lot of symptoms and enlarged lymph nodes and a big spleen. And then we do a PET scan and we find that the patient has enlarged lymph nodes everywhere. So very heterogeneous disease. Some of the lymphomas are more aggressive, like large cell B-cell lymphoma, and could present in a more aggressive fashion or with more symptoms or signs. But there are some very indolent, slow-growing lymphomas, like small lymphocytic lymphoma, that may present with very little symptoms or very little signs. Sometimes we find abnormal proteins in the blood. Let's say that a patient goes to see a primary care doctor, and they find that the protein levels in the blood in the routine chemistries are very high. So if they have high proteins, they do a protein electrophoresis, and they find that the patient has a very high level of an IgM, which is an immunoglobulin. And those patients may have or may be found to have a diagnosis of a lymphoplasmacytic lymphoma. So there are many ways to find out how the patient has or if the patient has a lymphoma or not. But in many cases, patients have no symptoms or signs.